Auzubillahiminash-shaytanir-rajeem. Bismillahir-rahmanir-rahim. Okay guys, I was recording and someone called. यही होता है जब आप काम करने लगते हैं, सबको आप याद आ जाते हैं, वरना कोई आपसे बात भी नहीं करता। खैर, तो मैं कहती कि हमें ज़रूरत है स्पॉन्सर की। अच्छा, हम पार्ट 2 कर रहे थे इसका स्कोरिंग का। सो अब मैं इंग्लिश में बोलती हूँ। सो गाइज, वी वर एक्चुअली रिवाइजिंग फर्स्ट, सो प्लीज़ ट्राई टू रिकॉल। दिस इज़ फॉर यू, आई ऑलरेडी नो दिस. So when the patient comes for booking, you're going to take history, right? So we have certain history-based risk factors, and we give a score of 4, like a direct score. We're not adding right now. Okay, we give a score of 4, we give a score of 3, we give a score of 2 and 1. Okay, so there's only one thing to which we give a score of 4 directly. Okay, and what is that? Please recall. That is an unprovoked VTE, right? And the opposite is a provoked VTE. So for a provoked VTE, we give a score of 3. So there are 3 things for which we give a score of 3. And what are those 3 things? Okay, we have number 1 is a provoked VTE. Number 2, medical comorbidities. What are those? Carcinoma, heart failure, SLE. Everywhere we have SLE. Okay, active SLE, right? And then if the patient is having a polyarthropathy, inflammatory polyarthropathy, IBD, doesn't sound that dangerous, but IBD, or if the patient is having type 1 diabetes with nephropathy, not alone, and sickle cell disease, and बाकी आप खुद ही देख लें. हाँ, if she is an IV drug user. Okay, so all these things. And then the third is high risk thrombophilia. So high risk thrombophilia is getting a score of 3. So these are the 3 things which individually get a score of 3. So what will be the score of low risk thrombophilia? 2? No, 2 is not for anything right now. So we're gonna do the opposite. So unprovoked was 4 and provoked was 3. So high risk is 3 and low risk is 1. Low risk thrombophilia gets a score of 1. And so there were 7 things which were getting a score of 1. One of them is low risk thrombophilia. And then we have a first degree relative and family with a history of unprovoked VTE. If the patient herself is having an unprovoked VTE, that is a score of 4. That's very dangerous. But if her first degree relative, her mom, her dad, her brother, her sister is having unprovoked VTE, not after a major surgery. If they have a VTE after major surgery, that's not in the scoring. They're not counted. But if they are having an unprovoked VTE without any surgery, then in that case, or estrogen, because of estrogen, unopposed estrogen, then in that case we give a score of 1 to that person because she is also at a